I believe all of us have one thing in common for us to be present in this event. We all apparently look healthy, absence of which will make us not to be present in this event. There are a lot of awareness and information about communicable diseases. We all know of HIV, tuberculosis, malaria, because of likely stigma and fear. However, most of us, and even the government and NGOs, tend to forget about one important aspect of our health, which is non-communicable diseases. Today, a lot of people have hypertension, diabetes, stroke, chronic kidney diseases, which are responsible for mortality of about 30 in 100 people in Nigeria. That is very important. Because of lack of funding, lack of attention, as I mentioned, and lack of awareness, efforts have been shifted to communicable diseases. And today, what we are seeing, you see a young person coming to the hospital with hypertension, diabetes, and in the past we used to think that these problems are problems of the elderly people, and even we think it is a problem of the Western world. But this is a present reality in our communities. So we all need to take action, and we all need to remember that these cases are happening. We are having cases in our homes. If I may ask, among your family or relations, I'm very sure that you have one or two persons, either parents, uncles or aunts, siblings that have hypertension, diabetes, or other chronic conditions. That means you are already exposed, you are at risk of having such conditions. So it is very important for us to always remember that these conditions exist and there exist gaps in this aspect. And what are the risk factors that predispose us to have these conditions? We are all having them. Today, the age is automatically a risk. As I mentioned, these conditions are more common among people between age of 30 to 60 years, even in Nigeria. So look at our population in this whole. I believe a significant proportion of our population here is comprised of this age group. And today, even among the younger age groups, we are still having this because of the risk factors. The other risk factors are unhealthy diets. We also have sedentary lifestyle, physical inactivity. So now, if you see a young person, age of 15 to 24 years, which are mostly undergraduates, so you realize that they think they are young, but however, the diets we consume, we mostly depend on these sugar-sweetened beverages. We consume a lot of salt, processed foods, and then we don't like exercise. So these are the reasons why there exist gaps which need to be bridged. And another thing is because today in our communities, we so much believe in traditional medicine. It's not that they are not good. However, there is always a risk and benefit. So you need to weigh risk and benefit. Is there accurate diagnosis? Even if the drugs are effective, were you diagnosed? Just yesterday, I consulted a patient that came with features of chronic kidney disease. He was telling me that he went to a traditional medicine healer who told him that he has kidney infection. But unfortunately, he presented with a very high blood pressure of 190 over 120. And automatically, the risk for his kidney condition is because of that high blood pressure. So I counseled him, informed him, because the commonest cause of kidney diseases in our environment and even in the world is hypertension and diabetes, long-standing, untreated hypertension and diabetes. But most of us are not aware. You need to treat yourself to prevent and protect those organs, the kidneys, the brain, the heart, even the eyes. So it is very important to remember this. We all look young, but that does not mean that we don't have chronic conditions. So it is very important that we take our health very important. By regular checkups in the hospital, it is recommended that every 6 months to 1 year as a healthy individual, you should go for checkups, at least for hypertension and diabetes. If it is